Hello, we're here this afternoon to provide you our weekly update on the status of our efforts to fight the coronavirus here in Nashua. Of course, one of our efforts is for people to wear masks when you go outside. That's one of the things I've been doing, of course, and I know that it's inconvenient for all of us. Why do I have to do this? But we, together, by doing social distancing, by staying apart, by wearing masks and taking the other safety precautions, washing our hands, using hand sanitizer, we are accomplishing something very big together, and that is saving lives, saving our friends, our family members, our neighbors, many people here in Nashua. So I just wanted to remind you that the masks are very helpful in preventing the spread of the virus. Well, I know you're most interested in our local picture here. You can see, of course, on the national media what's happening nationally. But right now, as of this morning, there have been 5,571 cases, coronavirus, COVID-19 positive cases in New Hampshire. 10% of those people have been hospitalized, and unfortunately, 6% have died. In Hillsborough County, there have been 3,145 cases. And in Nashua, so far, we've had 605 positive cases. 605 patients who have contracted COVID-19. Of that number, tragically, 32 people have died. Most have recovered. There are still 44 active cases. Our public health department, our public health nurses, have located 96 contacts that our 44 patients have been in contact with in the days before they became symptomatic. And public health is following those, working with those 96 contacts to make sure that they quarantine and they help prevent other people from contracting the disease. Bobby Bagley, Director of Public Health, is going to be here in a minute, and she will give you various updates from public health. In Nashua, 10% of the people who have contracted the virus have been hospitalized, and as I said, 32 people have died. But one very positive feature of our watching of the science, and we are relying on the science, on the medical experts, because we know that's what makes the most sense. We know that's the sensible approach. We know that you want us to handle it that way and try to protect people in the best way that the scientists can tell us that we can, is that the percentage of tests that are being conducted here in New Hampshire that are coming up positive, in other words, out of all the tests that are done in a day, what percentage are positive for COVID-19, that percentage has been dropping now for nearly 50 days. So that is a very significant indicator that the prevalence of the virus is declining. We at one point were above 10%, 11 or 12% testing positive. Now it's declined to just a little over 5%. So that is very good news. In our neighboring state of Massachusetts, which was a national hotspot, no question about it, they have done a very good job in terms of controlling the further spread of the virus. Their positive tests have been going down to the point where they're testing less than 5% positive. Also, all of their other numbers are good. The average deaths on a 3-day average has declined by 83%. So they are seeing very positive results. But we still need to be careful because other states, and I'm looking at some statistics right here, other states like Florida, like Texas, have seen a major reemergence of the virus because they have opened up too early. In Florida, back in May, they were seeing about 800 or less new cases a day, and Florida is a pretty big state. In recent days, they've jumped to 4,000, about 4,000 new cases a day. And we've seen on TV that they did not exercise the same caution that we have here in Nashua, in New Hampshire, and in Massachusetts. So that is why we have to continue to be vigilant. We want to make sure, if we possibly can, that there's no such reemergence here in Nashua. We want to protect as many people as we can from getting this dangerous virus. The governor has issued reopening guidelines, and we're, of course, acting pursuant to those. He first opened, for example, outdoor dining, and so we enabled expanded outdoor dining in the downtown area, a lot of outdoor tables, distanced by the proper distance so that social distancing is exercised. Now the governor has authorized 50% occupancy inside restaurants, and he will be issuing guidelines as time goes on, relying on science, relying on the medical data to make decisions as to when exactly to continue the reopening process. Here in City Hall, and that's where we are now, we are closed to the public and have been since March 18th, but services are still being provided as normal. Some of our employees are coming in and working right here in City Hall. For example, the brass doors behind me, in back of that are the automobile registration people, people who register your cars. They're working every day to make sure that people's cars can be registered. They have a system where you either call or email them, and they will either deal with the re-registration or registration by mail, or you can drop off your documents out in the back of City Hall, and they will take care of it that way, process the paperwork, and then meet you out there and deliver you the new plates. Many employees are working behind the scenes to provide the same level of service. We are not offering in-person transactions as of yet. Payment for services can be made at www.nashuanh.gov. But we are continuing to plan to reopen at least to a certain number of people every day. Our target date is July 6th, Monday. That possibly could be delayed because one thing that we're doing is we're moving automobile registration temporarily from this area behind me up to the city auditorium on the 3rd floor. And the reason for that is using GOFER, those are federal anti-COVID-19 funds, using the GOFER funds, we are going to rebuild the area of automobile registration to create greater separation between customers and between the city employee and the customer to make sure that we don't encounter any spread of the disease here in City Hall. And we're going to be rebuilding the city clerk's office as well as automobile registration, places where there's a lot of interaction between a number of people. So while we are rebuilding automobile registration here, automobile registration will be done upstairs with the proper separation and distancing, again, to minimize the spread, minimize the risk that there could be any spread of the disease. City clerk is also doing city clerk's functions without in-person visits. You can do mail-in requests for dog licenses, hawkers, peddlers licenses, overnight parking permits, birth and death certificates, marriage licenses, and with them as well, you can make an appointment if you simply call them or email them. If you want to register to vote, they will make an appointment for that. You can call them or, again, email them at the city clerk's office. The other activities continue on as always. People are working, making sure we meet payroll. Our city employees have been very dedicated. We have first our teachers that are teaching remotely, a very difficult challenge. That has been required a lot of dedication of our teachers, and they've tried to meet the needs, although teaching a young child something like reading remotely is certainly much easier said than done. And as I've talked to many parents, they've told me that they've been involved in some of this remote learning, and they've found how difficult, how much skill you really need to be a good teacher and to teach young children and kids of all ages the subjects that they need to learn. Our first responders, our public health nurses, our police and fire have also been working, our public works also, they've all been working normally and providing service to the citizens of Nashua. So that is an update regarding COVID-19, at least the status as of today. I wanted to mention a few other things that are going on, just because I believe they're important. Yesterday we had an initiation for the Greeley Park boat ramp, which at the end of Hills Ferry Road enables people to launch their boats into the Merrimack River, a very beautiful and major body of water. That Senator Jeanne Shaheen was here for that, and that is now available. There still is more work to be done, but it is a project that is nearly complete. We're also in the middle of the census. We want every person in Nashua to be counted, working very hard on that because the amount of federal aid and other things that can come to the city depends upon our population. So we value every person. Every person counts. We want to make sure that every person in the city gets registered by the census so we have an accurate calculation of our population. Another couple things that are going on, we have a virtual Pride celebration coming up on June 27th. As you might know, we held a Pride parade for the last 2 years, a very successful event through downtown Nashua, and a Pride Festival following that. We're very happy to be able to host that event, the sponsors being the main sponsors, the City of Nashua and Great American Downtown. But this year, because of the COVID-19 virus, we felt we could not do the normal parade, didn't want to bring that many people together, so instead, we have a virtual celebration, and so on June 17th, you'll be able to watch via TV or computer the celebration that we've put together for people to enjoy. So we're looking forward to that. Something else that has happened is that the farmers market opened last Sunday. Now you might remember that the farmers market has been down on Main Street for the last several years. We couldn't do that again because we've expanded the outdoor dining downtown. And therefore, we decided to move it here to the park next to City Hall and into the into the plaza in front of City Hall. It's a very shaded park next to us. It seemed like it went very well. People enjoyed it very much. There was still people keeping apart from each other, of course, and wearing masks during the farmers market, but there were a number of vendors, and there's a one-way way to walk through the farmers market so that it limits the contact between people, and that was very successful. And I encourage you to go down there and get some fresh vegetables and many other things that are occurring down at the farmers market. That's every Sunday from 10 a.m. to 2 p.m. And finally, as I've mentioned, the outdoor dining has been a very major success. We've seen many people enjoying themselves downtown. I've received tremendous amount of positive feedback, both from customers and from our small businesses. That is one of the primary reasons, small business recovery for the expansion that we've undertaken, because we know that the small businesses downtown have really been hurting as a result of the closures, and expanding the outdoor dining has enabled them to start to get back on their feet, jumpstart them towards hopefully a full recovery following COVID-19. I've also heard from the small business owners. One of the restaurants has put out a statement regarding how helpful it has been. Michael Buckley from Surf and from MTs, and one of his statements was that you have probably saved many of us, meaning many of the small businesses downtown. We appreciate his remarks and all of the positive feedback we have gotten from the downtown business community. Our goal is to build a stronger economy bring jobs back both downtown and in the small business sector throughout the city. So with that, I'm going to turn you over to Bobby Bagley, who's the Public Health Director. Bobby and her staff, the public health nurses, have been doing a great job on many things at the same time here, but of course COVID-19. They've done a great job in testing, in locating positive cases, working with contacts, so-called contact tracing, to make sure that we remain safe. And the fact that we've had 605 cases, could have been a lot more here in Nashua, is largely due to their efforts. So I want to thank Bobby and her staff, and I will bring Bobby up right now. And remember, wear your masks.
Good afternoon, Nashua. My name is Bobby Bagley, and I'm the Director for the Division of Public Health and Community Services. First of all, I want to thank Nashua, our citizens, and our guests and our visitors for the work that you've done to help us do our jobs in public health. The mayor talked about the numbers of cases, the numbers of contact investigations, and the mayor talked about how we've seen a decrease, a flattening, and even a decrease in the number of cases and the number of reports of the percentage of positive that come back as a result of our testing efforts. Those are all really good signs for us in Nashua. And so with the collaboration of all of your city departments, with police and fire, with our businesses, Nashua has done a tremendous job with curbing this coronavirus and actually flattening the curve so that, as we have seen, our businesses can open, and we've had some success with that as well. So I want to say thank you to our citizens and to our community for supporting all of our efforts and for working together with us. In my update from our public health perspective, along with the case investigations that we continue to do, because we still have positive cases still being reported, we continue to do testing because that's very important for us to continue to learn where we may have exposure, where there may be infection, and to be able to address that as quickly as we can by doing our contact investigation and by doing our contact tracing. And you can continue to help us with those efforts because it takes all of us working together to be successful in this effort. If you get a call from public health, from one of our public health nurses or from one of our staff that's looking to get more information about exposure, please answer your phones because that is really important to helping us identify individuals, make them aware, and then to help with quarantining and isolation to keep this virus at bay. The mayor also talked about how New Hampshire looks in comparison to some of our other states. We've been successful in opening up our businesses and in opening up activities that we want for our community to be able to enjoy, to be able to bring back our economy. We still want to, and public health is still pushing for us to do that in a very measured and calculated way. And so the stay-at-home order has expired. The governor has issued the Safer at Home ordinance for us to work with as we continue to open up our services. We do want folks to go out and enjoy the summer, enjoy the services, enjoy the restaurants that are opening, and all of the other activities that we can engage in to help with our mental health, to help with our well-being, and just to allow for us to start getting into this new norm or this new normal in a way that's safe for us all. So with the Safer at Home ordinance, what that looks like for us here and us keeping our numbers down is when you go out to make sure that you do have your facial coverings and your masks. Also to make sure that if you believe that you've been exposed, that you get testing. And testing is offered at numerous locations now because of the availability. You can still get tested through the Public Health Department by calling our COVID hotline at 589-3456. As of July 1st, we will be shortening those hours from 8 until 5. Currently, we're taking calls until 9 o'clock in the evening. We will start shortening those hours and make them available from 8 to 5. And we'll also answer any of your health-related questions. So even if you're not calling to get tested or to set up a testing appointment, we will still answer any questions that you have about COVID-19. Over at 18 Mulberry Street, we've been having the community come over for services. And as of July 6th, when the city opens up, we will be having our clients come over for welfare appointments by appointment only, and also for environmental health. All of this information will be updated on our website underneath the pages for environmental health, for welfare, for community services, and for community health. There'll also be signage on the door. If you arrive, the doors will still be locked, but if you arrive, the phone numbers will be there for you to call for the department to come downstairs and check you in. You'll notice when you come over to the building that we are doing screening because, again, we're trying to maintain your health and safety as well as the employees at the city over at 18 Mulberry Street. So there's a series of questions that you'll answer, and there's also a non-touch temperature that will be taken as well, and that will be expected of all of the visitors over at 18 Mulberry Street. We also have masks at the door, so if you come over and you don't have a mask, you will be able to receive a mask with our Division of Public Health and Community Services emblem right on the side of it, but we will have those available. We will continue to offer testing in the community every Thursday. Our hours have switched to 3 to 5 p.m., and because of the availability of testing at other sites, we've reduced it by 1 hour. It is still by appointment only, and as I mentioned before, 589-3456 is the number that you call to schedule those appointments. At our testing sites on Thursday, we're doing the nasal swab, which is a test that allows for you to know if you have the virus now. There are other areas that are offering antibody testing. I have 3 here that I'll share with you. Clear Choice MD, which is located in Goffstown or in Hooksett, is offering the antibody testing. You can reach them at 603-667-9075. Quest Diagnostics is located right here in Nashua at 300 Main Street and Suite 301B. They're also offering the antibody testing. You can make an appointment there by calling 603-578-0323. And Express MD is located in Manchester, is also offering antibody testing. And we do know that some individuals are interested in getting antibody testing if they've already had PCR testing. At Express MD, that phone number is 603-625-2622. And again, that testing is to let you know if you've had the disease. If you want to know if you're currently infected, it is the PCR testing with the nasal swab that you want to have done. Public health recommendations, we are still strongly, again, we have the Safer at Home ordinance in place right now, and we are still recommending that you stay at home if you're sick, that you make sure that you wash your hands as often as you can before eating, when you're coming, when you're going, after going to the supermarket, after putting your groceries away, that you make sure that you wear your face coverings. And we're going to talk a little bit more about the importance of the face coverings. That you maintain social distancing, staying 6 feet away from the person that's not a part of your family unit or someone that you spend time with in your home on a regular basis. That social distancing is really important for us to maintain reduction of exposure. As things continue to open up in our city, it's an opportunity for more people to gather together in spaces. As much as you can, you still want to avoid large gatherings, especially individuals that have underlying health conditions such as hypertension, diabetes, you have asthma, lupus, any chronic disease. If you are in recovery for cancer or on any immunocompromising medications, you want to make sure that you stay out of those large crowds. If you happen to go out for dining in our outdoor dining areas, make sure that you have your mask on until you're seated at your table. And once you're seated, have your dinner. And once you are ready to leave, put your mask on as you leave or exit the restaurant or the space where you're having your dinner. The other thing that we want to encourage people to do is to get tested. if you've been out and you've been engaged in a setting where there are large numbers of people, and if people aren't wearing masks, you want to make sure that you get tested, or if you don't have on a mask. And we do have, people who, don't want to wear a mask. If the majority of folks are, it allows for us to protect those who are the most vulnerable. Because there are some people who cannot wear the mask because of health reasons. And for those individuals, if the majority of us are wearing a face covering, we are reducing our respiratory droplets from being exposed in the environments where those individuals are. So we're protecting their health. Nashua, I asked you earlier, and I thanked you for working with us together as we continue to combat this illness. And by wearing our mask and doing the social distancing and staying home while we're sick, this is how our community continues to build resiliency in working together around preventing COVID-19 and further exposure. I say that the masks are important because early on, when this pandemic first began, yes, people did hear different information about the masks. We were told that there were certain masks that you should wear because of the protective factors. And so the N95s, the surgical masks, and the cloth masks are 3 different types of masks that are available. The surgical mask and the N95s are the masks that we want to reserve for our medical personnel. There's an abundance of these supplies available right now. We are expecting for there to be a second wave or increase in cases of COVID-19 in the early part of the fall and just before flu season hits. So we want to make sure that those supplies, although they are plenty right now, we want to make sure that those supplies are available in the event that we do see a surge in cases of hospitalizations or in places where the healthcare providers really need to have access to those masks. The cloth face coverings are just as effective for what we're doing in the everyday public, which is out in the community. And the reason why they're just as effective, because our goal with having the face coverings is to make sure that our respiratory droplets do not escape beyond the mask that we're wearing. So we're protecting those that are in close vicinity to us. And if we're all doing that, we're protecting each other. And again, for those who cannot wear the mask because of health reasons, we're protecting them as well when they're in areas where we are. We want to hear from you, Nashua. I get emails on a regular basis, different questions being asked about as we open, what are the safest things to do. We want to continue to hear and get those emails. So please continue to contact us. And you can contact us on our website or directly through email. My email is bagleyb@nashuanh.gov. We hear from people asking questions about the parks and about recreation, so please do continue to send those messages to us. We also want to hear from you through a survey that we've put out, and you can access that by our website, www.nashuanh.gov, and go under the Division of Public Health and Community Services, and you'll find a community health assessment survey there. That will give you the opportunity to share what are your concerns about health, as well as answer some questions about COVID-19 and how this experience has been for you. So we do want to encourage you to participate and let your voice be heard by participating in that survey as well. I did receive one question that I would like to go ahead and answer, and it is a question from Kimberly Houghton, who is with the union leader. And Kimberly asked about Greenbrier, which is one of the healthcare facilities, long-term care facilities here in Nashua, about the outbreak and how things are going there. During this COVID pandemic and our experience here in Nashua, we have had 2 of our long-term care facilities affected, Huntington early on, and Greenbrier. At the current time for Greenbrier, things have stabilized. The total number of cases at that facility ended up being 151. There were 117 residents that were affected, and there were 34 staff that were affected for that total of 151. There were a total of 20 residents that passed away due to COVID-19. The first case was actually on May 8th, and the last case or most recent report of a case was on June 18th. So I mentioned that things were stabilizing there, and we continue to have updates with Greenbrier to learn about how they continue to do well with this particular outbreak. Things are under control, and as we all continue to take the measures that are necessary to prevent continued spread, we'll see less and less of these outbreaks in some of our facilities. One of the new things that is going to happen is that long-term care facilities will be allowed to have visitors. They will have very strict guidelines and guidance in place for those visitors because we know that those long-term care facilities were greatly affected, and our highest number of deaths that have been recorded in New Hampshire have been in those long-term care facilities. So when you think about going to visit your loved ones there, we definitely want you to make sure that you follow the guidelines that they have. And when you're visiting in other places in our businesses, please make sure that you wear your face coverings, that you maintain your social distances, and please don't go anywhere while you're sick. That's how we can continue to be successful here in Nashua as we continue to work on maintaining and curbing COVID-19. There's about 24 states right now that are showing increases in COVID cases and activities, and the mayor talked about at least 2 of them that have had significant increases in one day. We have a chart that we look at, and it's being presented that they're in the red zone already, and at least Arizona, I know the mayor mentioned Florida and Texas. New Hampshire does not have to be one of those states. We can continue to operate and do the measures that we need to so that we can keep our numbers down, so that we can continue to open up our businesses and continue to get back to business and enjoying the beauty of the state of New Hampshire in a way that's safest as possible. Thank you, Nashua. Thank you for your efforts. Thank you, Mayor, for all of the great work that your leadership has provided for us in securing our city and making us safe.
Well, before we conclude, we received a couple of questions that I did want to answer. The first question is, can people drop off property tax payments? And the answer is yes. You can drop off your payment back in the back of City Hall off the Elm Street entrance. There's a parking lot back there. There's a mail slot, and if you just put the payment and your receipt, your bill into the mail slot, you'll be taken care of, and you'll receive a receipt in the mail. Next question was, how did the boat ramp, the new boat ramp that I spoke about, get paid for? The answer is we received a state grant, federal money coming through the state from the Land and Water Conservation Fund, paid for approximately 50% of the cost. And in addition to that, Public Works did a lot of the road work coming in. The access into the boat ramp was in the parking lot is being worked on now. Public Works is doing a lot of that. So it was a combination of local funds, the federal state grant, and then some in-kind effort by Public Works. So with that, we will get back to you probably in a couple of weeks. Thank you for tuning in, and please wear your masks and stay safe.